I want to start by explaining to you what the ScHARe Cloud platform is. This is mostly for the new people today. ScHARe stands for the Science Collaborative for Health Disparities and Artificial Intelligence Bias Reduction. It was actually created, next slide, by the National Institute of Minority Health and Health Disparities, the National Institute of Nursing, and the Office of Data Science Strategy at NIH. We are also forming other partners, such as NIH ScHARe and Office of Women's Research and Office of Behavioral Health. Next. This is a big thank you to the people who have funded us and supported us up to this date. It takes a village to launch something like this, so these are people that we are especially thankful for. Next. This is what we're going to cover today. First, we're going to do this overview, and then Luca will take you through a recap of the things that we've already learned, but it's going to be very quick. So those of you who are brand new, might not understand everything we're doing right now, but if you go back to our webpage at the NIMHD, you can actually review all of the videos and all of the slides. And we're also always here to answer any questions you have in the interim or in between Think-a-Thons. We'll also do the data sets, and we're going to have a special sort of demo for you today about showing what we can do with the BRFSS. So this is a visual. And the last thing that we're going to do is deal with the billing and costs, how to set up your accounts. Now, we've been trying to get to that now for the last 3 or 4 weeks, but hopefully today is the day. Next. So I'm going to let Kevin take over now and explain to you how to use Slido and how to do the polls. So I'm asking all of you to do this. It really helps us to tailor our trainings. It helps us to monitor our progress and to determine if we're actually hitting our target audiences. So please take the time and do the Slido part of the Think-a-Thon today. So Kevin, do you want to take over?
Absolutely. I'll just give a quick recap here. So as Dr. Durand mentioned, we'll be using Slido throughout today's webinar to get some feedback from you, the participants. To use Slido, you can either download the Slido app on your phone or simply go to slido.com on either your phone or your computer. Alternatively, you can simply scan the QR code that you see on the screen here on your mobile device, and it will bring up Slido for today's webinar. So to join today's Slido via slido.com or the Slido app, just enter code SHARE4, which you see listed on the screen here, when it prompts you to enter code here. For those of you on slido.com, that will be at the top of the page in the blue box, like the one you see here on the slide. When we do get to the time for each Slido, the code will be displayed on the screen. So no need to worry if you haven't gotten there quite yet, but you will have time once we get to the interactive portion of today's Think-a-Thon to complete some polls and provide us with some feedback. So thank you for that. And Dr. Durand, back to you if you want to, or should we launch right into the first poll we have?
I just want to mention also for those of you to make it really easy, Mark has put the link into the chat, so you can just click on the link and it'll take you right to the correct page. Okay, Kevin, go on.
Would you like to launch into our first poll here?
Yes.
Okay, wonderful.
So what we're asking you here on this poll is, what is your current experience with many of the different questions that we're going to ask here? So this is our experience poll. We got about 31 people responding. Can you start showing the results, please, Kevin? So this is actually very indicative of our typical Python use cases. We have a guest today, Cindy Sheffield, and she is, you can turn your video on, Cindy. She's going to help us with Python next week or next month. So this is a good indication that we much need your services. The second question, please. Many people, because R is also a statistical package, has a little bit of experience with R, but also still not everyone. Next. This is why we are doing the seminars, because there's not much experience with cloud computing. So I'm showing you this because I don't want you to feel that you're the only one who doesn't know what's going on. None of us do. Next. Of course, Terra is a special program that is the interface to many clouds at NIH. So this is why we are taking a very slow, methodical, no jargon approach to teaching you how to use Terra. Once you know how to use Terra, not only will you be able to use ScHARe, but you'll be able to use other platforms at NIH as well. Next. Many of you are health disparities researchers, so you're part of our target population, because we are trying to increase the representation of health disparity populations in data science and women. Next. Again, health outcomes research is what most of us do. Next. And this is another part that we'll be moving into in the future on algorithmic bias mitigation, because as many of you know, and probably why you're interested in learning how to do this, is that you have heard and have seen that AI is not fair to everyone. And we need all of you to stay involved and to become at least proficient so that we can mitigate these biases and make AI better for everyone. Go. Keep going. Keep going.
You want to start the
slide.
poll?
So the next. Yeah.
Deborah, this is Cindy. I just want to take the opportunity. Thank you for queuing me in. I'm on vacation this week, so I'm not camera ready, so I won't turn on my video. No worries. But I think this is such a fantastic project, and I love what you're doing. So I wanted to be on here and make sure that I know what I'm doing for next month. So thank you.
Thank you for popping in, Cindy. And sorry you're on vacation.
No worries.
Keep going, Kevin.
Dr. Drink, do you want to see this next poll? Because we
Yes.
reached the end of the previous poll.
Yes, keep going, please.
Okay.
See, that's government dedication. Even when we're on vacation, we work. So as you can see on the screen, many of you are all in the same place. So ask questions and know that we're all trying to learn AI tools and cloud computing to gain new skills for research leveraging big data. That is our whole goal. Next.
That's the end of the polls. Would you like to just see the next slide?
Back to the slides then, please.
Okay, great.
Next. Next. So ScHARe is a cloud, and it was developed to fill 3 critical gaps: women and underrepresented population in data science. We really are trying to create that paradigm shift in research thinking that leverages big data instead of just doing the one little project data set on your laptop. We can learn so much more by having more data available to us. So we're trying to create that shift in thinking. And of course, the AI bias mitigation. Next. ScHARe has several components to it. It has data sets. It is many of our data sets, and it's the only cloud at NIH that has applied social science, behavioral, environmental, social determinants of health data sets. It is our focus. Some of the other programs, like all of us, have a survey of social determinants of health, but we are focused on that particular data sets. We're going to have a data repository, which is coming soon. We have computational abilities, and we have multiple tools that will help you, and we're going to learn some of those today. It is a Google platform. In other words, Google is behind all of this. Terra is our front page, which is what we're doing now. And of course, it's connected to GitHub and the ScHARe portal. Next. In this data ecosystem, we have 3 different types of data sets that we have on here. We have a Google hosted, meaning these are data sets that actually come with Google. They're national data sets. We also use the word federated. So you will hear that term a lot. You'll see federated Google or national data sets. Federated data sets means that all the PII is out. So there's no personal information in it. They've been cleaned up and they've been ready so that they can be on these large platforms. We also have ScHARE-hosted datasets. These are typically national datasets, but they're not hosted by Google, but they're very important to us. So we host them on the ScHARe platform, like the Behavioral Risk Survey. And then we have funded datasets by ScHARe, by any NIH grant that can come onto it as well, like the Jackson Heart Study and intramural and extramural. So this is one of the platforms that serves both intramural and extramural. Our data sets are arranged by the social determinants of health, the 5 categories, the health behaviors, and the diseases and conditions. Next. The data sets we have now are approximately 200 data sets. When we're fully populated, we're probably going to have around 300. Many of these data sets also have multiple years. So you can have 10 years of data on here as well. So you can do trend analysis and different types of things like that with longitudinal data. This is just a very little snippet of the 200 data sets that we have and all the tools that we use: Python, R, BigQuery, TensorFlow. We have notebooks. And for the novice user that doesn't know how to use Python and R, we are also working with Terra to integrate SAS. SAS is a statistical program so that you can actually run the analysis in SAS instead of Python. The reason this has been a challenge is that most statistical companies don't have a cloud computing model. So the only reason we're using SAS, so I can know some of you going, oh, but I like SPSS or I like something else better. The reason we're using SAS is because SAS as a company is trying to develop a cloud model. Hopefully the other statistical companies will do the same. Next. Of course, we're going to work on bias mitigation strategies in the future and try to deal with many of the biases that are harming health disparity populations. Next. Next. So this year we will complete phase 1. Next year is going to be phase 2 of this, and in phase 2 we will start the actual data repository, and we have core common data elements that are going to enhance our ability to create harmonization and data interoperability, which is very important in a cloud computing world where you need big data. You have to be able to combine data sets. Next. This is an example of how core common data sets, really common data elements, help us. So each project can have other project data, but if they're linked with the core common data elements, we can actually merge them together easier. And so if you have a bunch of data sets like the septagons on the side, if all of them are using the same core common data elements, you can actually create that harmonization at a much faster pace. Next. And then another thing that we're doing is we're taking the core common data elements and we're actually mapping them to federated data sets so that you can end up taking your own individual project data from your studies and actually connect it to some of the major data sets so you can get a whole different view of something that's happening in an environment, especially if you use a zip code. And the other major issue that we're going to achieve that is ScHARe, all of us, Biodata Catalyst, and Anvil all use the Terra platform. So you'll be able to use them, but what is great about this is that we are going to interconnect with each of these platforms so that you can also do things like if you connect with Anvil is genetics, you can do epigenetic studies because we have the social determinants of health data and they have the genetic data. We're in active negotiations and strategies with Biodata Catalyst right now. Next. This is how you sign up to stay attuned to ScHARe. Next. You'll get all of these slides, so not to worry. These monthly Think-a-Thons are 3 different types. They're instructional. We're going to move very shortly in about 3 months into the actual research teams. So we want all of you to skill up so that you can participate in those research teams as well. And in those research teams, we hope to have mentoring and coaching to help each of us to create better and different research for health disparities and health outcomes, healthcare delivery services. Next. So I'm going to turn it over to Luca, and he's going to recap the previous Think-a-Thons that we've done up to this point. And as I said, if you're new to it today, this might be a little lost for you, but you can go to our webpage and look at the slides. Luca?
Sure. Thank you so much, Debbie. So I'm going to do a brief recap of the previous Think-a-Thons. First of all, I would like to make sure that everyone or almost everyone has access by now to the workspace that we're going to use during this event. So I'm going to paste an address in the chat, and I would like everyone who is already registered to please log in and let me know if you have access and you can see the workspace. so that in the meantime, we can work in the background to get you added. So this is a workspace that I'm referring to. And for those users who can log into Terra, please let me know.
The address isn't in there.
I'm sorry.
The address is not in the chat.
Yes, I'm pasting it right now.
There you go.
Perfect. So for everyone who can log into Terra, please let us know if you can see that workspace. Perfect. Thank you so much. In the meantime, I'm going to show users how they can, well, let's skip the registration part.
I was going to say, let's give them a few minutes. People should be logged in. Just use your fingers, your thumb on your reaction thing to make sure that you're in. So most of you should have, I mean, they've given you access now. So
thank you. Perfect. Thank you, Megan. We'll add you. Ali, can you please add Megan while I talk? Okay, perfect. So for those of you who haven't logged in yet, I'm going to show you how you can do that.
just give them one more second to get there. Okay. And what Luca's doing here is when you're at this web page, you should put it into your favorites because we know this is going to be your favorite site to go to.
Like the suggestion. So let me know when you're ready and I can show you the next steps.
Okay.
Perfect. Okay, so I'm just opening a new window. So I would invite everyone who has not logged in into Terra to copy that address from the chat, paste it in the address bar in their browser, press enter, and you'll be brought to this page where you can log in to Terra. So you just have to press the login button here. And then, as I was explaining before, the sign in with Google button. So when you click on it, you're brought to this page. Please input the email address that you gave us. Okay, I'm gonna input a random one. Click next. And then your password, the one associated with the Google account you're using. Okay. And then please press next. Okay, then if you see this screen, let us know.
Slow down. Let him get there.
By the way, the first time you register for Terra, there is an additional screen that will ask you to accept their terms and conditions. So you just have to, read them quickly and press accept at the end of the page. I cannot display this because I'm already registered. And I ran out of random Google addresses to use for demonstration purposes.
You have a limit.
So, but it's just a page where you need to accept their terms and conditions. And then if you see this page after that, let us know. But if all goes well, you should see this page, which is our workspace, which it's the workspace we're going to use for demonstration purposes for this event. Okay, so in the meantime, that if you agree, I'm going to demonstrate the next steps. I'm going to do the recap.
Okay.
Okay, so what we saw during the first Think-a-Thons was how you can create a workspace. So this is a workspace, right? So it's a space dedicated to your analysis, to your data, to your collaborations with other researchers. And how can you create one exactly like the one you are showing on screen, you are seeing on screen now? So, let me actually walk you first over what a workspace is real quick. So you can see that there is a dashboard here where you can put vital project information. right? So your goals for the projects, etc. And the next section that is important to be aware of is the data section. So this is a section where you can actually upload and access all the data you need for your projects. And in our case, you can see that there are tables here listing all of the data sets that you can access on ScHARe. So we divided them, as Debbie was saying before, in categories based on the social determinants of health categories, with the addition of health behaviors and diseases and conditions. So I just want to show you how you can click on any of these, or let's pick health behaviors, for example. And you can see that on the right, you can now access all of the data sets available for that category. So in this case, this is actually one of the data sets we're going to use today for our example. And you can see that we have multiple years for that data set. So 2012, 2013, etc. And if you scroll to the right here, you can see that there are links to the data to access the data. There are links also to helpful materials such as, the data dictionary for the data set and other helpful information. For example, in the file format, or links to the home page hosting the data originally. Information on the size of the data set, again, the source it comes from, the sponsor, and then tags to facilitate your research, your search among these data sets. And we have also like an advanced search functionality that you can use to look up these data sets. So these are the main categories. The first table here lists all of the data sets that are available right now. And this is a copy of our official workspace. So if you go to the other one, you'll see that there are now more than 200. And the next section I want to point your attention to is the analysis section. So in the analysis section, we have a list of notebooks. They're called Jupyter notebooks. I'll show you what one looks like later. But it's basically where you can conduct your analysis. So they are documents where you can include text like descriptions of your project, explanations, and also code to actually perform the computations and run your analysis. And it's a really nice way also to collaborate with other researchers and collaborators, because for each notebook you can decide to share your workspace and your notebooks with other people you're working with. And I'll stop here. I won't go over workflows and job history. We'll get there another time. So what I want to show you now is how each of you can create their own workspace to start working on Terra. So if you go to the menu at the top left of the page, these three stripes here, you click on it and you can go to workspaces. You click on the workspaces section and you're brought to this page that lists all of the workspaces that you have access to. And hopefully you should see ScHARe, our official workspace, and also ScHARe Think-a-Thons, which is our the workspace we're going to use today for demonstration purposes. If you want to create a workspace, all you have to do is click on this plus button. You can see that create a new workspace appears when I hover on it. So click on that, and you'll be brought to this page where you'll be asked to input a name for the workspace. I just put in a random name. And then you're going to ask to, you'll be asked to select a billing project to, cover the charges associated to your computations. So in this case, you can select ScHARe 10, which is the billing project we are giving you access to for this day. So click on ScHARe 10. Don't worry about the rest. You can input a description if you want. Not necessary. Don't worry.
Luca, I don't know if it matters, but I did not add people to ScHARe temp. I added people to ScHARe reader. I can go back and do it, but I added people to ScHARe read-only access because I thought that's what you told me early on.
Yeah, and that's fine. So everyone should have access to ScHARe temp. So the billing project was shared with that group.
Oh.
So it should be fine. Let me know if it's otherwise, but I gave everyone access to the billing project. Everyone in the ScHARe read-only access group. So thank you, Ali. But let me know if there is anything to be fixed. Okay, perfect. Then you can input a description, and then you can create the workspace by pressing on this button here. Create workspace. I'm going to do that. And again, apologies, I'm trying to summarize everything, and probably I'm going too fast for some of you, but this is just a recap. So I'm trying to, okay. Yeah, of course, these already exist, because one thing you have to keep in mind, you cannot reuse the same name twice. So I'm going to make it a little more complicated.
So Luca, I think you
Yes.
might need to go back just a little bit, because we're getting a lot of people not seeing where you're at.
Okay, perfect.
Cancel there, come out, and
Okay,
just
I'll
go
go
back a little bit.
Perfect. I think this is important. I want everyone to be able to follow. So where should I start? Like creating a workspace?
Not creating a workspace, but to get people to our workspace.
Okay, perfect. Oh, that's actually really easy. All they have to do is
I don't think they're on this screen, so go back one more.
okay. Perfect. Yeah, we started here.
So help them from here, because there's quite a few in there.
Okay, perfect. So can everyone see this workspace? Does everyone have access? Okay, so some of you don't have access. Oh, no, okay, most of you. Okay, perfect. So it's not about your homepage. To get to that workspace, you have to click on this link that I pasted in the chat. So that's the address for that workspace. And you should have been given access by us. So now you should be able to see it by clicking on the link. So please try that. So if you click on that link and you don't have access, please let us know. So it's could not display workspace. So let me make sure that that workspace is shared with everyone. I'm going to just verify that everything is set up correctly. Ali, are you there?
Yeah, what,
Okay,
what?
yeah, I just wanted to show you that that workspace is actually shared with
Yep,
both
I got
groups.
that. I got that. I see that.
Okay, perfect. So we are good here. I mean, there's nothing else.
Yeah, it should be.
It should be here. Everything should be all right.
Right. So anyone who's not able to access the workspace is not on the group. So maybe resubmit. And what option are people making their own copies?
Yes, later. Yes.
Well, okay, I have some people asking.
Mm-hmm.
So if you can't see the workspace, send me again directly, maybe your email, and I will add you again.
Okay, perfect. Because from our standpoint, everything is set up correctly, so you should be able to see it. Okay, perfect. Thank you, Alan. Great, thank you so much. So should I go on, Debbie?
Yeah, for the majority of people who can see this, let's move on to these other, and for those of you who still can't get to this, please email Ali directly and she'll help you.
Okay, perfect. So I was demonstrating how you can create your own workspace. Okay, so you don't actually need to follow my steps, but I still want to show you how it's done. So workspaces, you can access. Yes.
Look at let's. Okay, so let me try to make some things clear right now. Right now, we're going to work in our ScHARe. Everyone's going to work in our ScHARe workspace. So you don't really need to do anything right now what Luca is doing. And I'm thinking that this is creating some confusion. So I'm going to suggest we skip this because I think there's too much confusion. So what we were going to try to do was just recap what we've done in the past, which means how to create your own workspace, how to do things like this. But I think it's creating too much confusion. So we're going to just start with the lesson today. And we'll recap the ScHARe process. It's going to be our very last presentation of the tutorial. So everybody will have a chance for the recap and how to do everything, not in a slow way, but I think it's just too much right now. So we're not going to recap anything. We're going to start into our lesson today.
Okay, perfect. That makes sense.
Too much confusion.
Perfect. And then I'm opening up.
And while Luca is booting up here his stuff, Kevin put into the chat the link to where you can get to all of our past presentations and all the past slides. So you can always catch yourself up as well and go through those recordings as well. And one of the nice things about doing it on your own pace and in your own recording, you can stop it and practice and stop and practice as you go along versus what we're doing right now. It's just, you have to go at our pace. But when you do it on your own, you can go at your own pace, fast or slow. Okay. So Luca's keyed up now. So we'll get started with what today's lesson is. No recap.
Perfect. And in addition to what Debbie said, I just want to explain that the recap that I was going to do is actually in our slides for today's event. So you see there are instructions to do everything that I would have explained in person. So you can find all the instructions here as well. That's probably the easiest thing to do. Perfect. And then, so let's start. So about the data sets that you can use on ScHARe. So you can use two kinds of categories of data. So data that you upload to your workspace, right? So for example, you have a project and you want to work with your project data. Instead of doing it on your computer, you want to work in a workspace on Terra. Then the second category of data that you can use on ScHARe is data that is already in the ScHARe data ecosystem. And as Debbie was saying before, we have three categories of data sets: the Google-hosted public datasets, the ScHARE-hosted public datasets, and the ScHARE-hosted project datasets. Now, the Google-hosted, we focused on last time, right? So there are datasets hosted by Google, publicly accessible, federated, and hosted by Google through the Google Cloud Public Dataset Program. I'm going to show you some examples in a minute. And then the ScHARE-hosted public datasets are the datasets we are going to focus on today. So they are publicly accessible, but they are hosted by ScHARe, so by us. And an example is the Behavioral Risk Factor Surveillance System dataset, which we're going to use today for our example. And then the ScHARE-hosted project datasets are mainly for NIH grantees and intramural investigators. We're not going to focus on those today. Then here you can see some examples of the Google-hosted datasets. So as you can see, there are some interesting datasets, right, in this category. So the American Community Survey or US Census data, the Area Deprivation Index, Medicare, and so many others. So all of these are relevant to health disparities research. And then for our ScHARE-hosted datasets, which are in addition to those hosted by Google, we divided them and categorized them based on the social determinants of health categories. So all of you know, I'm sure, that the social determinants of health are the non-medical factors that influence health outcomes, and there are several categories. So in the first category, education access and quality, We have data on, for example, graduation rates or school proficiency, early childhood education programs, or interventions to address developmental delays. And two examples are, for example, the data files from the Department of Education with graduation rates and participation proficiency assessments, or the National Household Education Survey Program, which is about educational activities in the US. And the next category is healthcare access and quality. So this includes data on health literacy or use of health IT, emergency room waiting times, access to care, access to a primary care provider, or access to high quality care, etc. And you can see some examples here. So I just cite one, for example, the Dartmouth Atlas data. So it's about selected primary care access and quality measures, such as quality of care for diabetes, mammography, leg amputation, etc., for example. The next category is about neighborhood and built environment. So you'll be able to find there data on, for example, access to broadband internet or access to safe water supplies, toxic pollutants, or data on environmental risks, etc. And you can see a few examples listed below, like, for example, the National Environmental Public Health Tracking Network with data on environmental indicators and exposure to pollutants and hazards. The next category is social and community context. So here you will find data on crime rates, for example, like the hate crime statistics from the FBI. So data on crimes motivated by bias against race, gender identity, religion, disability, etc. And also data on resilience to stress, for example, or experiences of racism and discrimination. Then the next category is economic stability. So data on unemployment, poverty, housing stability, food insecurity, etc., hunger, work-related injuries, etc. So an example could be, for example, the Food Access Research Atlas from the Department of Agriculture with food access indicators for low income and other census tracts. And in the health behaviors category, we collected some data sets that are related to health-related practices that can directly affect health outcomes. So, for example, BRFSS, right? So the Behavioral Risk Factor Surveillance System data set that we mentioned before, which has state-level data on health-related risk behaviors, chronic health conditions, and use of preventive services. And finally, the last category is diseases and conditions. You would be able to find data on incidence and prevalence of specific diseases and health conditions. And like two examples that I'd like to make are, for example, the chronic disease indicators on 124 chronic diseases, or the data on, for example, organ transplantation, which is also very interesting for health disparities research. And as I showed you before, the easiest way to actually check what data is available is to go in our analysis section. I'm going to show you later. And there is a list of all of the data sets that are available on ScHARe. While if you need to access the data, the right place to go is our data tab that I showed you before. So in the data tab, you can actually access all of the data you need. Then I would like to ask you a question at this point. And Kevin, can you please help me with Slido? I'd like to ask you a question on, what other data sets you would like to see, and also on which combinations of data sets you think will provide the most insights to the kind of research that you intend to perform. So this will inform our future efforts.
So one of the things that you can do is on the ScHARe platform where Lucas showed you the data sets, the very first one has like 100 and something data sets. If you click on that button, you're going to be able to see a bunch of the data sets that are there. So that'll give you kind of a quick view. You can also scroll down on the front of the front page and you can also see.
Thank you. This is all very interesting.
And just as a reminder here, after you submit your responses, you can upvote other responses. Use that little thumbs up icon to upvote other responses. And that way we can see which ones are the most popular, which ones are the ones that people agree the most with.
So if you see a data set that you really like, you don't have to type it in again. You can do what Kevin said and just hit that little thumbs up, and it starts to give us a sense of many people who are interested in it.
Perfect. Thank you so much. I see data sets including Native American populations. That's important. Maternal health, substance use data. Some of them we actually have, so I'm glad that you find them helpful. Yep. Health and retirement data. Thank you for that. Women's health. Thank you. This is so helpful to us because what we're going to do is we're going to review your answers after the event and actually try to add those data sets that you need to the platform. Correctional facilities health data, like that. Occupational health databases, we are working on that. We have a couple of options that we are considering. Racism exposures. Chronic pain. Mental health. Perfect. Thank you so much. Should we move to the next question?
Yes.
Debbie, would you like to comment on this one?
Sure, I'll do it. So one of the things that we're trying to get at this and why we're creating sort of a paradigm shift in thinking is in the new system that we're building, you're going to be able to combine data sets by just a click and drag. So what we're interested in, and it takes a little work to make that happen, right? So it's not like it's an easy thing to do, but we're doing some prep work to make it happen. So we want to get a sense from you all, what are the data sets you would like to see combined? So for instance, if I was looking at maybe a genetic database, I would want to combine it with American Community Survey that by zip code that shows me where grocery stores are or where environmental toxins are. So what are some of the data sets that you would like to see combined? Because remember, in using AI, you can use very large data sets. And that's how we create them. You merge data sets together.
A genetic database, if long code, like that. Experiences of social isolation and exclusion in relation to mental health and well-being. autoimmune and environmental toxins. Yeah, thank you for adding your comments in the chat as well. If possible, if you can add them on Slido so that they don't get lost, that would be even better.
And if you have trouble getting to Slido, you can just scan the QR code or look up to Mark Gifford's text, and he has a link to it.
Yeah, emotional trauma and gene expression changes. Very much like that. National chest pain database.
Okay, so it's kind of slowing down. So feel free to keep adding to your Slido comments, and we're going to move on to the next thing. Luca?
Perfect. Okay. So you should see my screen now. Perfect. So today we're going to see how we can work with the ScHARE-hosted data. And we'll have an example, but this will teach you also how to work with every data set that we host. So as I was saying, you have these two categories of data you can work with, right? And today we're going to focus on the ScHARE-hosted public data sets. So to do that, we will use a notebook. So as I mentioned before, a notebook is an interactive analysis tool. It includes documentation that you can add to make it easier to share with collaborators your analysis and reproduce them. And then it also contains code cells for actually doing the computation, so manipulating and visualizing data in real time. And you can do that using Python or R. So those are the two main languages that you can use in terms of coding. And to get the most out of our tutorials, you probably have to be familiar with programming, but if you're not, the code in our notebooks is really easy to understand and also to reuse. So don't get discouraged. And our tutorials will also, help you a lot to learn how to work with data. And we'll also point you to a series of resources that you can use to learn programming and, to learn new skills.
And excuse me, Luca, and I'm going to put in a plug now again for our next month Think-a-Thon. We're going to feature I call it the prep for Python, because what gave me this idea was my grandson took an intro Python course and he just stopped. He goes, I don't understand any of this, because he didn't have the jargon. He didn't have the terms, the language that was done in a course. So our next month's Python course is going to give you that understanding and that jargon to help you get ready to take. Oftentimes free Python is available courses, but you have to sort of know the lingo to even get anything out of it. So our next Think-a-Thon will be for you.
Perfect. And this is a list of our instructional notebooks. They're going to be in the analysis section. I'll show you. But you can see that there are some introductory ones on how to set up the environment, and then some on how to access the different categories of data that we have available on ScHARE. I just wanted to mention that you have this resource available. And by the way, if there are any educators among us, notebooks can be great instructional tools, because you can integrate explanations with code. And so they are perfect teaching materials. I just wanted to mention that. Okay, and we will use Python, of course. And I just want to highlight that we're doing that because almost 70% of data scientists actually use Python and prefer Python to R. And there are many free resources that we would like to point you to. So you can see some of them listed here. They are like, there are 6 links in this page, but many of them have links to hundreds of resources. So it's really extensive. So please visit those links, and it's really interesting. We also support R. Terra supports R, and in our notebooks, you will see that some of the notebooks are prepared to show you how to use R to accomplish the same goals, for those of you who are more familiar with the R language. But we're going to focus on Python for this event. And we will work with BRFSS data. So I already introduced this data set earlier, and it collects state-level data about US residents regarding several aspects. So health-related risk behaviors, chronic health conditions, or use of preventive services. And it's mostly based on telephone surveys. And it's the kind of data that is used by states or by institutions to help establish and track and local and state health objectives, to plan health programs, and to implement disease prevention and health promotion activities, and to monitor public health trends. Okay, so that said, let's start. So I'm gonna share my screen with you, my browser. Okay, so let me exit from here. Okay, perfect. So I would invite everyone to follow these steps. Let me paste the address where you need to go in the chat. Okay, so I would invite everyone to click on that link that I just pasted in the chat. And let me know if you see this on screen. Give you some time to do that. Okay, perfect. Thank you. Then once you're here, go to the analysis section by clicking on its name. I'm going to do that. And you see that you will be presented with a series of notebooks that are, our analysis, our instructional notebooks that we provide, plus some other test ones that we use for the Think-a-Thons. So I'm going to ask you to click on number 7. How to access, plot, and save data from ScHARE-hosted datasets using Python 3. I'm going to click on that. And then I would ask you to wait before opening the notebook. So is everyone at this point? Debbie, I know that you're monitoring the chat. Let me know when I can go on. Okay, perfect. It looks like
it's pretty good. So you can explain the page, give a little bit of time for people to catch up.
Sure. So this is just a preview of the instructional notebook that we're going to use today. And actually, I think everyone will have plenty of time to catch up, because the next step involves creating the environment. And that usually takes a few minutes. Okay. So I'm just going to go ahead and ask everyone to not click on open, but to click on playground mode instead. Because I'll be the one clicking on open here. And I want everyone else to do the same things that I'm doing without having to complicate matters by copying this notebook. Ali knows what I'm speaking
Sorry,
about.
I don't have the playground mode.
You don't have it?
Yeah, I only have the open button.
Okay. Does anyone else have the same problem?
Yeah, I also don't have the open or the playground mode.
Okay.
I have open only.
I have open only.
Okay. So let's do this.
make sure you're in the right workspace and not in a clone of the workspace, because only one person should be able to be in open.
Right.
So check and make the full URL has to be the same.
Ali, another way to do this, we can ask everyone to create a copy.
No, just Luca, go back to where the URL is, put it into the right URL so that everybody's in the same spot.
Yeah, sure. Okay.
Okay, so everyone, don't click other things on your page. Just click what's in the chat.
It still only gives me open. It does not give me playground.
Ali, it's still doing no playground.
That I don't know. That's a back end question. Oh, I know what's happening. You have to open first. So the reason is they don't have a VM running. So you click open to start the VM, and then you have to click open a second time. But when you start the VM, it'll after your VM is running, you'll have the playground mode option. Sorry, I was spacing. Yes.
Okay, perfect.
You need to click open. So your VM is running. So on the right-hand side, if there's no Jupyter logo, or if your Jupyter logo has a different color, does not have a green, you will not have the playground mode option. So you need to click open in that case. And then it'll, there's a place for configuring your VM, and the defaults are fine. So you can just click create. Yeah. So yours will not have the people who haven't started a VM will not have the pause option. And then at the very bottom of the Jupyter Cloud environment page, there will be an option to start. Yeah, sorry, I should have realized that.
No, no worries.
Yeah.
Thank you.
So you have to click, you have to click open to start your VM that's going to run the Jupyter notebooks. And then once your VM is running, you're going to be able to click playground mode.
Okay, perfect. So the VM is it stands for virtual machine. It's like
right.
a copy of.
Right. So yeah, it's a little confusing because it's open in both cases, and maybe launch would be better in the first case, but there you have it.
Perfect. Thank
So
you.
if you just see open, that means you need to click it so you can launch your computer in the cloud.
Perfect. Thank you so much. And
So-
virtual machine stands for
Luca, you need to back up and walk them through that.
Okay.
So back up, because you got a lot of people not there.
Thank you, Debbie. Okay, so everyone is on this page, right? Analysis. Then the next step is go to this notebook here. Number 7. So someone create. Yeah. Okay. So this one here, how to access, plot, and save data from ScHARE-hosted datasets using Python. Then click on it, and you'll be brought to this page.
But you're not going to see the playground open yet.
As Ali was saying, those of you who haven't used this before are not going to see the playground mode yet. There is one additional step that they need to take, but everybody's going to see open. So click on open. Those of you who don't have the playground mode option, and you'll be brought to a page where you can, it looks like this. And you can configure your virtual machine, which is a copy of your computer. that is supposed to help you do all the computations in the cloud. And just leave the default values here. Don't worry about changing anything. But advanced users here can decide what options they want for their computer, how powerful they want their virtual computer to be. You don't worry about anything, just click. There should be a start, right? At least there's a start button here for first-time users.
She might be in a breakout now, helping someone.
Okay, perfect. Yeah, sorry, I can show you, but I've used this before, so.
So
Okay.
someone that's doing this, is there a start button down there that you can click?
It says create at the bottom.
Okay.
Create.
That's
That's the
Yeah. Yeah, if you scroll to the bottom of that screen, you find the create button, and it's pretty simple from there. Yep.
Thank you, Ali. So
Thank
leave the default values unchanged, press create, and then it's going to take a couple of minutes for the virtual machine, for this virtual computer to be ready.
So when you scroll down to the bottom there, hit create and then just give it a minute, because there's a lot of people doing it at one time. So it takes a little bit of chipmunks to keep running.
Deborah, I'm not in a breakout and I don't have an option to get into one. And
I'm sorry, I asked Kevin to put you in and
yeah,
into one.
yeah, and I'm not seeing it.
Kevin, please put Allie and Angela Holloway into a breakout.
I'll take care of that now. This is Mark. I'll take care of it.
Thank you, Kevin.
Both.
Also put Ann.
Wait.
Please.
So Angela just texted Google syncing permissions. Yes. That's because I believe that's because there are so many people on this call. Google has there's a syncing thing. And Terra has been working on making that quick, but I suspect that that's Angela's. Yeah.
So Mark, also put Ann Burt into a breakout with Angela and Ellie will help the two of them. Thank you, Ellie. Okay, so I think the rest of you look like you're getting there. So now you should be able to see playground mode up on your top of your screen.
And you should also see cloud environment is ready.
So looks like many of you are getting there. Chris, I'm gonna just say this out loud to everyone. There's, like Ali just said, there's lots of people doing this right now at the same time. So give it a second and go back and try it again. Mark, will you please put Marie-Claire Boutrin in with Ali?
Debbie, let me know when it's a good time to move forward.
Well, there's some that, I mean, there's a processing problem. So give a few people like Chris time to go back and do it again, because there's just too many people trying to do it at once. Okay, Zeki, that's fine. Just leave it there. As long as you got the playground tab, you're good. Okay, it looks like people are there. So the people that are having issues, if you raise your hand, Mark will put you in with Ali to help you individually. because I know this is kind of frustrating. And we want you to be successful and learn how to do it. So just be patient. And we have lots of help for you. So if you're having trouble, if you raise your hand, Mark will put you into a breakout room with Allie to help you individually, okay? And for the rest of us, it looks like we can move on. And some of you that are putting information in the chat, I'm going to ask you just to be patient a little bit. You're not going to be able to activate Jupyter and a bunch of all these other kinds of things that you're jumping around doing. Just follow what Luca's having you do for right now. Okay. So Luca, go ahead.
Perfect. So we invite everyone to click on Playground Mode. Accept here. Click Continue. And then you're going to have to wait while the system copies these analyses so that you can work on them. Perfect. So this is what a notebook looks like, right? So you can see that there is documentation, right? So all these explanations that we added on, how much this would cost, or, the data set, or I'm sorry, this is.
Just give him a minute because this system is slower.
Okay.
Would you jump out?
Yes, I. Okay. Sorry. So this is the wrong one. That's why. So it looks like this one is the wrong copy. Give me a moment. I'm trying to locate the notebook. Okay, can I stop sharing for a moment? I need to verify something.
Sure.
Thank you. That if we want to use this time to bring everyone up to speed.
So with all the jumping around, he's sort of got lost in all the mire of the back and forth. So he's rebooting it to get to where he needs to be. So just hold on a few minutes. All of you should be on the share, and looks like most of you have the playground mode. So just give us 1 second.
Ali, may I ask you a technical question?
Okay, so I think what I'm gonna do, Luca, is to go over the slides. And
Sure.
while you guys can do that, okay? So I'm going to do you remember what slide you left off on?
Yes. We only had to, I mean, we can discuss billing and costs. So slide 57. You can go over at that part if you prefer.
Okay. So I'm going to share my screen.
Okay.
Can everyone see my screen?
We see your desktop.
Can you see the slideshow now?
No, we cannot.
All right.
Dr. Duran, just let me know if you want me to share the slide. I'm happy to do so.
This again. Okay, now you should see it, right?
Yes, but just put it in presentation mode and we'll see it.
Okay, so you see the slides, right?
We see, yeah, but we see 12 slides at once.
I'm gonna go over, so Luca's gonna find the data set part of this. But while he's doing that, I'm gonna go over the ScHARe billing, because there were lots of questions about billing. And so I will go over those slides because we don't really need the platform in order to do this, but this will help you to understand the cost of the cloud. But let me just also back up and say to you that one of the reasons that we've developed this cloud platform is because we know that cloud computing can be very expensive. And we don't want that to be a barrier for people with from health disparity populations to use it. So we are doing many things within this cloud to make it affordable and reasonable for everyone. So just for an example, all of the data that is in our workspace, you'll be able to use basically free of charge because we're paying all the hosting costs. The time where you guys have to pay is when you start to do some analytics. But the analytics part, especially with population science data, is not as expensive as doing, like, for instance, genetics data that can run for like 2 or 3 days. That would be a much higher cost. So even, I'll give you an example. Even though we have approximately 100 people on a Think-a-Thon at a time doing different analysis, the most it ever cost us is a few $100s. So it's not that cloud has to be expensive. It's just how you use it. So I don't want people to think that, oh, I'm not going to use cloud because it's too costly. The other thing that we're really working hard at doing is making sure that you can actually download some of the big data sets onto your laptop and run different analysis, and then upload them back into your workspaces so that you can actually have a better reduced cost. So I'm going to walk you through basically what happens when the cost on working on Terra, on Terra platform. First of all, this is kind of just an example of the kind of things that you're going to see. the CPUs, the memory. You don't really have to pay attention much to that because this is kind of standard. You can customize it, but the customization is more for people who do like terabytes or petabytes of data, and we're just not there. So most of this part of it, just leave alone. Let it be exactly the defaults. It doesn't make any difference on your cost. There is a storage cost for data storage. You can download data into your workspace and what we call buckets. But again, of all the data sets, and I told you we have like 200 data sets on there, the cost for me to host data sets on the cloud is less than $100 a month. So it is not expensive to store most of this data. When you create these buckets or into your workspace, you're going to pay a little bit of cost for this, but like I said, it's not expensive. Terra runs on a Google platform. So when you first register onto the Terra account, you're going to be asked for 2 billing accounts. One of them is the Google billing account, and the second one is the Terra billing account. But don't freak out. You are not charged twice. It's only that Terra is an interface. So that interface, you know, it's just one of those technical issues. So Terra and is an extra, or they have to say billing, but you're only charged one time. It's not twice. So as we said earlier, what will your cost incur today? It's free. We use a temporary account. We leave that account open for 24 hours, so you can have a chance to set up your own billing or work within the cloud platform that we have currently. Every user, when you first register for Google, gets $300 in free Google Cloud credits. Those cloud credits you can use for data storage, for computation, etc. They didn't used to have a time limit on it, but now they have within 3 months. So you want to, once you sign up, you want to go in and start playing with some of the data and do some analysis so that you can benefit from your credits. So when you set up billing, you sign into the Terra using your Terra ID, and you click your cloud billing account. Even though when you first set this up, you're not going to be billed at all for the first $300 that you do. So you're not going to get billed at all until your credits expire. Again, Terra doesn't actually charge you. You just have to set that up as well. So if you there's a screen in which you can also monitor your cost. Notice where the arrow is. It's like 6 cents per hour. So like I said, it's pretty cheap. And the computational, like when you pause it, it's like 1 cents per hour. And the whole data set is like $200 per month or $2 per month. So you don't have, so the myth is that it's very expensive. It's not. Also on the very first screen, remember that when we first logged in, there was a bunch of icons over on the side. Those icons are telling you what your workspace cost is, so you can always monitor how much you paid or how much you need to pay or how much your account is being billed. And it basically gives you an estimated cost for the storage, and then it'll give you the actual cost. Again, if you're going to move a data set and you put it into your own workspace, as you can see, the download cost is less than a penny. We run a monthly check all the time because, you know, we run with hundreds of participants participating. But every one of you can see this also in your own workspace. So this is kind of important because remember, when you create a workspace, you can create that workspace just for yourself, or you can invite other users to come into your workspace. When you invite other users to come into your workspace, their billing cost for analytics is charged to your workspace account. So this is a way for you to monitor what other people are doing also in your cloud, in your workspace, I'm sorry. And as we explained, you can also do this with teachers, can put students in their workspace, or you can put your research collaborators in your workspace. And this is the way that you would just check it. And all you have to do is come over to the billing icon and scroll down to reports, and you get this page that actually shows you the cost. All of this, of course, has lots of guides and tutorials for you to work on or work with to understand better. So this is, when you get these slide sets, all you have to do is click on the guides, and it will help you understand the billing costs, how to move the data for different storage. And keep in mind that we are very conscious of the cost of this. So as we develop the data ecosystem, you're going to actually be able to drag and drop and do many of these combinations of data sets without actually developing additional cost. So we are very mindful of the financial burden that cloud computing can do, and we're doing everything to mitigate that. Luca, are you ready yet?
Hi, Debbie. I sent you a message. We are solving some technical issues on the Terra side. I'm working with Ali to solve them.
All right. Well, I'm going to go back then to the slide.
Thank you. Yeah.
Just go over this as a little overview.
Dr. Duran, we also had a few questions come into the chat while you were speaking. I don't know if now's a good time to get to those.
Let me see I can't see the chat when I'm in presentation.
So up top, you should see a little bar with a bunch of things, and you should.
So we probably answers to the last 4 questions. What were the last 4 questions?
So you just need to scroll up and see the.
If one's data is on Azure, can it rate to a Google data set? Okay, so Terra is an interface. It doesn't matter what the background is. It can be Azure, it can be Google, or it can be AWS. So Terra works in front of all of those cloud platforms. And answer, can you, yes, all of this information will be publicly available. So when I'm trying to back up to the different questions. Okay, so the question is, are you charged if you don't run code, but you forgot to pause the Jupyter environment? The answer is yes. So one of the things that you want to do is to be sure that you always stop or pause or close. Don't leave things open because they don't know that you're not using it. It just looks like it's still running or still on.
Deborah,
So
that's not entirely true because Terra does have an auto pause function. And if you don't turn it off, your notebook will pause after half an hour.
Oh, good. So after a half hour, it shuts it off for you. Kind of like my curling iron. Let's see, the other question. If I can't see all the questions as I'm going up, if I didn't answer somebody's question, can you just come on and ask it? Unmute and ask.
Can we please have this presentation, the recording?
We've put the link in multiple times and we've said everything, the recording, the video, the presentations, all will be posted on the NIMHD webpage.
Okay, thank you.
If I haven't answered any questions, please just jump on because it's hard for me to see the chat with the things open.
I think there was
You don't mind? Oh, sorry, go ahead.
I think there was one question about budgeting, and if your organization can do it ahead of time to kind of block out if there's parameters or a template for what they can put into budgets.
Say that again, Brett. Can you talk closer to the microphone?
Sure. I think someone's asking whether there's a template for parameters for budgets so people can put it into their organizational budget going into the budget season.
You mean on the Terra platform itself?
Just anywhere for if somebody's trying to use Terra and put it into their budget for any organization, you know, you have one person that's going to spend 5 hours on it a month or something like that, you know, general budget outliers, maybe perhaps.
Yeah, so I actually researched this question with a few academics, deans of academic institutions, because we did a special seminar for educators. So even with, and we have approximately 100 people per Think-a-Thon, and even though we have that many people working at one time, we have costs are no more than $1,000 per Think-a-Thon. So I offer that as a guesstimate of potential analytic cost from 1,000 to 5,000 per couple hours. And what can be done is that when academics, probably like many of you on here, put in your budgets for the year, you can actually put that in, you know, calculate how many hours you might want to do and submit that as part of your budgets. I also learned from the academic deans that you can request from your dean an account which is linked to a lab fee to your students. So if you're teaching a data science course and you have students or a research co-op, you know, like a research lab, you can actually create a like a lab fee or a course fee. And then the school itself, the dean sets that up of your school, and then everything is billed to that account once you started in class, and the fees that the students paid or your graduate students or whoever you're using goes, they deal with the main cost, and then the system, your school can pay for the use itself. So there are many different ways to actually start incorporating this into your budgets.
That's
For
awesome. Thanks, Deb.
you who actually apply for grants, in your grant application, you should put in the cost for cloud computing. And you should put, I'm just going to recommend this for all of you who submit grants. Submit for a data scientist that knows how to use the cloud and can actually clean up your data and to get it ready for a cloud computing. And all of that is acceptable request in funding. Okay. Did that answer the question?
Yeah, that was great. Thank you, Deb.
If you don't mind, my cloud environment details are not active. The settings, close and open. So I do appreciate if I have guidance on how to reactivate it.
You mean as we're waiting here? You're something
If you
like
don't, yeah, it's for the settings and pause and open, they are disabled.
okay. I guess maybe you can directly in the chat ask Allie to help you. Any other questions?
Thank you.
It's Allie Califf. Okay. If there's no questions and we're still waiting for this other technical issue with Luca, I'm going to go over the slides we skipped earlier as an overview to what we had done before. And this is the sort of the background recap of what we've done. I just hold on, there's one more question. Yes, so the question is, if your laptop is big enough to handle big data sets, is there anything that Terra can do that a regular laptop can't do? A couple of things. For one, Terra has shared workspaces, so you can actually work on the same document. I know how to explain this. Many of you use SharePoint, or with SharePoint, you're able to go and you or Google Docs. You have an online document, and then people can go to that site and work on that document. So Terra allows you to have that workspace, very similar to like a SharePoint. And therefore multiple users can use it. There are what we also call workflows, and what Luca was going to show you today is that these notebooks actually have code that you can just cut and paste to run an analysis. So you don't have to write the code yourself. You don't have to create it yourself. It actually works just to, so you can get that on Terra. You can't get that on your own laptop. So there are many tools that are on Terra that makes it easier to do analytics and to use than you would find on your laptop. Also, what we find is that on a laptop, trying to run these big data sets, it is much more cumbersome and much more burdensome. Where in a cloud environment, it's much faster. Another question was, is Terra HIPAA compliant? So Terra itself is not the issue for HIPAA. It's the data on the cloud environment. So Terra is just an infrastructure. It's a like a template. The data that is on Terra is where HIPAA compliance comes into play. Right now on the ScHARe platform, we only have federated national data sets. So there's no PII, there's no personal information. By in the next, what is this, June? By September, we will have the ability to put PII data and upload project data onto the page. That is when HIPAA comes into play. And yes, all the data that will be put on will be in compliance for PII and for HIPAA compliance. That's something we're very conscious of. So there are disease level data on the current site, but we're adding more disease level data as well. Of course, we're focusing first on the diseases that are most prevalent in health disparity populations. There are no electronic health records on the system right now, again, because that's private information, and those kinds of access will come in a few months. So in HIPAA compliance of uploading your own data. So you noticed in the presentation I did, there's part 2 to the ScHARe platform. And when we get to part 2 of the ScHARe platform, you're going to be able to upload your own project data, and you're going to be able to mark the level of privacy and security that your data set requires. So we will actually go into another whole set of tutorials once that happens, so that we can help you learn how to load your data sets and to make sure that it is PII protected, whether it's HIPAA compliant or any other type of compliance that you need. So Ali also put into the platform that FedRAMP is authorized in FSMA moderate. So it is a, keep in mind, if it's in NIH, it's going to have security. And that is another really good benefit about a cloud platform like this at NIH. It's going to have a lot more security around it than your individual laptop. So you can add that as another benefit to Terra versus your own laptop. There's questions about IRBs. So we're not an IRB authorization organization. We will have documents that you have to, they're called DUAs. So they're called data use agreements. So those data use agreements will give us access to the different types of data and the privacy level of the data and what it's going to be used for. So we don't actually do IRBs. That's not in our purview. I think I've got all the questions. Any other questions?
Debbie, I wanted to give you an update. So there's a problem on the back end. So it's not us, it's the back end. And Ali's helping me together with Google engineers and to solve it. So I was thinking in the meantime, would it be helpful for me to do the recap?
Yeah, let's just do the recap and let them help. I was going to start that, but answering many of the questions. So.
Okay, perfect. Yeah, there's probably something wrong with the IAM permissions on the Google side. So they're working on it. It's not us, but I can do the recap in the meantime.
Okay, let's do the recap. And I apologize that we're not going to get to the news part of this, but you did get a little bit on billing, and we'll do this recap. And I guess we'll have to do this next data set thing in the next Think-a-Thon or after Python, because we already have Cynthia set up for Python. And so we'll do this next time.
Sure, we can.
I really want you to see the BRFSS Explorer, because that you're going to get very excited about that. And what is excited about it is that it can actually work with your own data sets, and you can create this yourself. You know, if you're a little savvy, or it also can be something that you can put into your grants to do. Okay, Luca, go ahead.
Perfect. Thank you so much. Okay, so let's do that recap. Okay, I share my screen with you.
Oh, let me stop sharing.
Thank you. Perfect. Okay, great. Okay, so this again is our workspace, and I was teaching you how you can create your own workspace, right? So by this time, everyone has access to our free building project, so you can take advantage of that to create your own workspace. So starting from the main page, click this button on the left, on the top left of the page, which gives you.
Let me just back up a little bit. Luca,
yes.
Explain why it's important to have your own workspace.
Oh, of course, so that's really important. So having a workspace allows you to work on your own projects. Like if you have some data for a research project that you want to work on, creating a workspace creates a confidential, secure space where you can work using your data and perform your analysis. And if you want to work independently, you can do that. If you want to collaborate with someone on that research project, you can easily share that workspace with your collaborators and decide what kind of permissions they have. So if they can only see your work, or if they can also make edits and, you know, collaborate with you on the analysis. So it's, you know, a very helpful tool. And you can create one by going, you know, to any page on Terra. You click on this button on the top left of the page, and then you click on workspaces, of course. So when you do that, you are brought to this page, which lists all the workspaces you have access to, because of course you can create multiple ones. And you can also see any workspace that has been shared with you by your collaborators, for example. So another important thing that you can do here is create your workspace. So you see this plus button next to workspaces. It says create a new workspace when you hover on it. So,
so for those of you, the reason you see ScHARe Think-a-Thons and ScHARe and Test 1.1, these are all workspaces that were created. So if we didn't create any workspace, then that would all be blank on your page.
Right.
So we create these workspaces because it allows us to let you in to do the work that we're teaching you how to do.
Perfect.
So Luca's going to show you how to create that workspace, because what you're going to do is you're going to create your own workspace and allow your collaborators, your students, your partners in research into your own workspace, so you have control over what is happening.
Perfect. So to create a new workspace, click on this plus button next to workspaces. When you do that, in this screen, you're asked to input a name for the workspace. So let's do that. Try to make it complicated because it can be identical to any workspaces you already have. And then select a building project. So this is the building project that will cover the charges, any charges associated with your use of this workspace. So you can use our free billing project that you have been added to. It's called ScHARe Temp.
But when I went over billing
Mhm.
and you created that your own billing account, both for the Google and for Terra, the name is going to show up for you to be able to select, because you can have many different billing accounts. And so when you create that billing account, be sure just to name it something that, you know, like this could be your personal credit card, your work credit card, you know, your purchase number, whatever you use to create it.
Perfect. So we select ScHARe Temp here. And if you want, you can enter a description for your project. Don't worry about the rest of the settings. It's security settings, and you don't need to worry about those now. And then you can click on Create Workspace at the end of the screen of this display. So I would do that. You know, it's going to take a little while. So we're all going to wait for this workspace to be created. And here it is. So as you can see, it looks exactly like ours. So there's a dashboard section, data section for you to upload the data, and an analysis section where you can start your analysis as you work with your data. So now that we have created a workspace, let's imagine a scenario where you want to collaborate with someone, because you can, you know, use your workspace independently, but if you want to collaborate with someone, that's, you know, even better, because this is what Terra was born for. So let's imagine a scenario where you want to collaborate on a project with two groups of collaborators. So for one group, you want them to be able to just see your analysis, but you don't want them to be able to modify anything in your workspace. And for another group, let's say they are closer collaborators, and you do want them to be able to write your analysis with you.
You're stuck on the analysis screen.
Yes, that's on purpose. Yes, no worries. I was trying to explain the scenario first.
Yeah, but you need to show them what you're talking about.
Yes, I was going to do that in a minute, but let's do that now. So if you click on the same menu in the top left of the page, and you click on your name, you'll access these sections here. And I'm interested in groups, okay, because I want to add two groups of collaborators. So I click on groups. I invite you to do the same. And you can see that here I have all the groups of people that I'm working with for this project. And I can easily create a new group by clicking on this button here that says create a new group. So I'm going to do that. And I'm going to create two different groups, because as we said, we want one group of closer collaborators and one group of people who can just see your activities but not modify them. So I'm going to enter a name here for the first group. So let's call it researchers, I don't know, closer collaborators. Something like that. And then I'm going to click on Create Group. Then, as you can see, the newly created group is here. Now, what I have to do, I have to get into this group and start adding individual collaborators. So I'm going to click on the name of the group. And then I'm going to add individual users here. Of course, I'm in here because I'm the administrator of the group, but I can click on Add User, and then I'm able to add individual collaborators. So I can do that using like a fake email address. Okay. And this, of course, needs to be a Gmail address. So I can now click on Add User. It asks me to confirm that I want to add this collaborator to the group. And I click Yes. Perfect. And if I want, I can add more users. So I do the same, collaborator number 2. And I add them as well. Confirm. And here I have my first group with 2 collaborators in it. Then I want to create the second group of collaborators. So I'm going to click on the usual menu on the top left of the page. Click on my name here to expand this section. I'm going to click on groups. And again, I'm going to create a new group by clicking on this button here. So I'm going to enter another unique name. I'm going to call this external collaborators to make it clear that I only want them to have read access. I don't want them to be able to modify anything. And then when I'm ready, I can click on Create Group. And then I can enter this second group that I have just created by clicking on it, and I can add users to it. I'm going to use fake email addresses. I'm going to click on Add User. I'm going to confirm. Perfect. I think one user is fine for this group for now. Then once I have created my groups of collaborators, the next thing I have to do is I have to share my workspace with them if I want them to be able to see it and to access it. So to be able to do that, I want to show you something first. So if I go back to my list of groups of collaborators, I want to point your attention to this group email. It says here group email, and it's an email address that I can use to immediately identify all of the researchers that are included in this group. So when I'm going to share my workspace with my collaborators, I don't have to, again, input every individual address. I can easily share my workspace with the entire group by using this group email and saying that I want to share my workspace with this group. So I'm going to copy this group email. You see that there is a very convenient button here next to it that says copy to clipboard. So I'm going to click on that. Okay, and the other one, I guess I just remembered. And now I can go to my workspaces section to find my workspace, because from there, I'm going to be able to share it with my collaborators. So I click on the usual menu, top left. Then I go to the workspaces section. And now I need to find it. Well, it doesn't really matter. I guess I can even share one of these, any one of these. Okay, here it is. Perfect. Okay, I located my workspace. And now if you scroll to the right, you can see that after the information on when it was last modified, when it was created, and the access level that I have, you can find this little menu here. So these 3 little points. Click on it. And here I'm given the option to share it. So I'm going to click on Share here. And here is where it becomes interesting, because I can share my workspace with that group of collaborators by using that group email that I told you, instead of using individual emails for each one of my collaborators. So I'm going to paste the address that I copied for earlier. Here it is. So this identifies all of my collaborators in that group at once. And I'm going to click Add. Perfect. So now my workspace is shared with the first group. And I have to decide what I want them to be able to do. So these are my close collaborators. So I want them to have writer access, not just reader, because I want them to be able to modify what I write. And I'm also going to give them permission to run computations in my space. You can decide that here. And then I'm going to click on Save. Actually, before I do that, we need to add the second group of collaborators. So I'm going to input here the name of that group, which I remember. So it was external collaborators. Perfect. Now I'm going to click on Add. And for these researchers, since they are external collaborators, I'm going to leave reader access selected because that's what I want. And then I click on Save. Perfect. And now I've created a workspace and I have shared it with my collaborators. And the last thing that I want to do is if I want them to be able to, at least my closer collaborators, I want them to be able to run analysis and I want to support their costs. I can go, I have to share to give them permission to access my billing project. So what I have to do is I click on the usual menu. I'm going to expand this section by clicking on my name. And then I have to go into the billing settings. So I'm going to click on billing. And you can see here that there is a list of all the billing projects that either I own or are shared with me. So in this case, what I want to do is select this billing project, which is the one that I'm using for that workspace that we just created. And I want to share it with my closer collaborators. So I click on it, and you can see that I can easily click on members here. Perfect. And then if I want that group to be able to use my billing project, I only have to click on Add User here. And again, I can use the group email that I showed you before to immediately share my billing project with all of the researchers in that group. So I pasted that user email, that actually group email here, and then I'm going to click on Add User. So this is optional, but now all your closer collaborators can actually use your own billing project to run their analysis, and you're going to support the costs. You can also decide otherwise if you prefer. Perfect. And then one last, Debbie, do you have time? Because I could go on forever, but you're at time. But I wanted to show them how they can create a notebook and run it, but I'm not sure if that's better reserved for the next time.
Well, we're going to recap, but it's also 4:30.
Mm-hmm.
So maybe this is a good place to stop.
Mm-hmm.
As we said, all of our presentations of all the past Think-a-Thons plus this one will all be on the NIMHD webpage. I'm sorry that we had technical difficulties with the share account, so we didn't actually get to the data set part and to show you the data explorer, but we will get there. So hopefully, maybe with all the storms, the cloud got angry and crying. So hopefully things will get fixed. And Mark actually put into the chat right now where all of this information is stored. So please click on that and save that link, because you can always go to the resource. So thank you for coming. And again, I apologize. I'm sorry that we didn't get to the data sets today. And I promise you we will get there. So I'll hopefully see you next month.